Good day. Today we will be discussing about the Philippine Health Agenda for 2016 to 2022 with the theme All for Health Towards Health for All. The Philippine Health Agenda 2016 to 2022, launched by the Secretary of Health in September 2016, provides the strategic framework for achieving these targets. The Philippines has made enormous strides in economic development and in the health of its people, but not all citizens have been able to benefit from this progress. Much remains to be done to ensure that all Filipinos are able to lead healthy lives, regardless of their age, sex, social or economic status, or place of residence. Under the motto All for Health Towards Health for All, universal health coverage is the platform for health and development in the Philippines, driven by action within and outside the health sector. Reducing health inequities is singled out as the most important priority among three health guarantees. Ensuring financial protection for the poorest people, improving health outcomes with no disparities, and building health service delivery networks for more responsiveness. The agenda aspires to create a society in which Filipinos have the means to lead healthy and productive lives, and have a health system where Filipinos feel respected, valued and empowered in all of their interactions with the system. Despite substantial progress, however, achievements in health have not been uniform, and challenges remain. Inequities persist between regions and population groups. Many Filipinos continue to die or suffer from illnesses that have proven cost-effective interventions, such as tuberculosis, HIV and dengue, or diseases affecting mothers and children. Many people lack the capacity to make informed decisions about their own health. The health system is fragmented, unable to provide services in a streamlined, cost-effective and equitable way. Thus, the core values of the Philippine Health Agenda aims to provide equitable and inclusive health system to all Filipinos, a transparent and accountable government that will ensure and assure the safety of the population with its maximum capacity, use of resource efficiently, and lastly, high-quality service that can be reached and be attained by everyone. The values of the agenda correlates to the overarching goal of the government to ensure that all Filipinos, regardless of age, gender, socio-economic status or cultural background, have the opportunity to lead healthy lives in healthy environments with access quality health services. For the past 30 years, the Philippine government have undertaken key structural reforms and continuously built programs that contributes to reach the goals for the National Health Agenda. First, health devolution or decentralization of health services was initially geared towards efficiency and effectiveness of health service delivery by reallocating decision-making capability and resources to local government units. Decentralization is a core element of the implementation of the primary health care, which is a strategy adopted by DOE in the late 1970s in compliance with the Declaration of Alma Ata on primary health care to ensure that essential health care is made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford. Second, Republic Act No. 6675, an act to promote, require and ensure production of any adequate supply, distribution, use and acceptance of drugs and medicines identified by the generic names. This law provided a wider range of options for all Filipino, ensuring medication to be readily available to any level of economic status. Third, under Executive Order No. 51, Series of 1986, in order to ensure that safe and adequate nutrition for infants is provided. There is a need to protect and promote breastfeeding and to inform the public about the proper use of breast milk substitutes and supplements and related products through adequate consistent and objective information and appropriate regulation of the marketing and distribution of the said substitutes, supplements and related products. Take note that hospitals strictly comply with this to contribute to the provision of safe and adequate nutrition for infants by the protection and promotion of breastfeeding and by ensuring the proper use of breast milk substitutes and breast milk supplements when these are necessary. On the basis of adequate information and through appropriate marketing and distribution. Controversial, hence, the Philippine Health Insurance Corporation is one of the key reforms that support the healthcare system of the Philippines financially. It was created in 1995 to implement universal health coverage in the Philippines. PhilHealth and beneficiaries have access to a comprehensive package of services, including inpatient care, catastrophic coverage, ambulatory surgeries, deliveries, and outpatient treatment. Through Bureau of Local Health System and Development, they have provided the Urban Health Systems Development Framework, which specifies the DOE approach to urban health systems by putting emphasis on the management of social determinants of health in urban settings with focused application on urban poor populations, particularly those living in slum communities or settlements, in order to reduce health inequities. With the vast restructuring of state hospitals to corporate entities, medical institutions will be allowed to engage in revenue-generating activities which shall help subsidize medical care to indigent patients. Fiscal autonomy is expected to usher in a more efficient delivery of health care as well as provide hospital administrators with the requisite flexibility for the effective stewardship of hospital assets, funds, management and personnel supervision. There are 4 major government institutions responsible for the delivery of healthcare goods and services in the Philippines: Department of Health, Food and Drug Administration, PhilHealth, and local government units. To meet regulations, providers must have effective governance, including assurance and auditing systems or processes. The systems and processes must also assess, monitor and mitigate any risks relating to the health, safety and welfare of people using services and others. Health financing is a core function of health systems that can enable progress towards universal health coverage by improving effective service coverage and financial protection. Today, millions of people do not access services due to the cost. Last July 2020, the Philippine Congress has allocated 71.35 billion for the implementation of the health care law. The budget is less than half of its original budget request of 153 billion. But because of the COVID-19 pandemic, the Philippine Health Insurance Corp. PhilHealth previously moved to postpone the implementation of the UHC law to mid-2021, saying that premium collection in 2020 fell to 90%. Provided with the goal and strategies to support better health outcomes in the Philippines, noticeable persistent inequities in health outcomes are to be addressed. Every year, around 2,000 mothers die due to pregnancy-related complications. A Filipino child born to the poorest family is 3 times more likely to not reach his 5th birthday, compared to one born to the richest family. 3 out of 10 children are stunted or with impaired growth and development. Financially, Filipinos are unwilling to be hospitalized or be provided with healthcare due to restrictive and impoverishing healthcare cost. Not to mention, low-income generating family least prioritize healthcare. Every year, 1.5 million families are pushed to poverty due to healthcare expenditures. Filipinos forego or delay care due to prohibitive and unpredictable fees or co-payment. And a 4,000 pesos monthly expenditure on healthcare expenses is considered catastrophic for single-income families. Consider those families with a family member having a kidney problem or other disease requiring long-term treatment. How can they survive with the daily needs if their expenditure will be converted to healthcare expenses? The Philippines is behind with its neighbor countries when it comes to quality and synonymous care. The country has yet to develop and build more healthcare facilities to decrease turnaround time and provide Filipinos autonomy to choose their healthcare provider. Technological advancement has yet to be developed in order to produce a unified and secured electronic health records that will allow ease on access of information wherever a patient may go around the country. In order to attain the goals for the Philippine health agenda, the current administration aims to provide universal health coverage, strengthen implementation of responsive parenthood and reproductive health care law, strict implementation of war against drugs, and acquire additional funds from PAGCOR. In order to attain health-related sustainable development goals, the Achieve strategy is followed with 3 guarantees to assure to every Filipinos. Guarantee number 1. All life stages and triple burden of disease, which will provide services for both the well and the sick. Guarantee 1 encompassed life stages from pregnancy to newborn and to elderly. It also includes the guarantee to aid and provide healthcare assistance with the triple burden of disease such as communicable, non-communicable diseases and malnutrition, and lastly, disease of rapid urbanization and industrialization. For your assignment, search and identify specific healthcare programs supported by the government in providing Guarantee 1. Provided in the slide are examples of programs per life stages. Guarantee number 2 encompass the service delivery network, which creates a functional network of health facilities. Services are delivered by networks that are and must be fully functional, compliant with clinical practice guidelines, located close to people such as mobile clinics or subsidized transportation, available at all times and even during disaster, practicing gatekeeping such as travel ban and localized lockdowns to prevent transmission of disease, and lastly, enhanced by telemedicine. Last guarantee of the National Health Agenda is the universal health insurance, which will provide financial freedom when accessing healthcare services. Under this service, PhilHealth will predominantly finance the service that will provide a gateway to free affordable care. Simplified PhilHealth rules such as no balance billing for the poor or basic accommodation and fixed co-payment for non-basic accommodation. And lastly, expand benefits to cover comprehensive ranges of services. The strategies for the National Health Agenda will be attained through advanced quality, health promotion and primary care. A healthcare system that will cover all Filipinos against health-related financial risk. Harness the power of strategic human resource for health development. Invest in electronic health and data for decision making. Enforce standards, accountability and transparency. Value all clients and patients, especially the poor, marginalized, and vulnerable. Elicit multi-sectoral and multi-stakeholder support for health. Advance quality, health promotion and primary care. Conduct annual health visits for all poor families and special populations. Develop an explicit list of primary care entitlements that will become the basis for licensing and contracting arrangements. Transform select DOE hospitals into mega hospitals with capabilities for multi-specialty training and teaching and reference laboratory. Support LGUs in advancing pro-health resolutions or ordinances, like city-wide smoke-free or speed limit ordinances. Establish expert bodies for health promotion and surveillance and response. Cover all Filipinos against health-related financial risk. Raise more revenues for health, for example impose health-promoting taxes, increase NHIP premium rates, improve premium collection efficiency. Align GSIS, MAP, PCSO, PAGCOR and minimize overlaps with PhilHealth. Expand PhilHealth benefits to cover outpatient diagnostics, medicines, blood and blood products aided by health technology assessment. Update costing of current PhilHealth case rates to ensure that it covers full cost of care and link payment to service quality. Enhance and enforce PhilHealth contracting policies for better viability and sustainability. Harness the power of strategic HRH development. Revise health professions curriculum to be more primary care-oriented and responsive to local and global needs. Streamline HRH compensation package to incentivize service in high-risk or GIDA areas. Update frontline staffing complement standards from profession-based to competency-based. Make available fully funded scholarships for HRH hailing from GIDA areas or IP groups. Formulate mechanisms for mandatory return of service schemes for all Heath graduates. Enforce standards, accountability and transparency. Publish health information that can trigger better performance and accountability. Set up dedicated performance monitoring unit to track performance or progress of reforms. Value all clients and patients, especially the poor, marginalized, and vulnerable. Prioritize the poorest 20 million Filipinos in all health programs and support them in non-direct health expenditures. Make all health entitlements simple, explicit and widely published to facilitate understanding, and generate demand. Set up participation and redress mechanisms. Reduce turnaround time and improve transparency of processes at all DOE health facilities. Eliminate queuing. Guarantee decent accommodation and clean restrooms in all government hospitals. Elicit multi-sectoral and multi-stakeholder support for health. Harness and align the private sector in planning supply-side investments. Work with other national government agencies to address social determinants of health. Make health impact assessment and public health management plan a prerequisite for initiating large-scale, high-risk infrastructure projects. Collaborate with CSOs and other stakeholders on budget development, monitoring and evaluation. With the Philippine Health Agenda 2016 to 2022, we will all achieve a health system with the values of equity, quality, efficiency, transparency, accountability, sustainability, resilience.